Good morning. So, general discussion or the introduction of these fibrinolytic drugs and the antithrombotic drugs already we have covered. Now we'll see about this type of the drug. Now, fibrinolytics. Now, what will happen? Fibrinolytics, they will act either directly or indirectly to convert plasminogen to plasmin. Clear? They will useful to you convert the plasminogen to plasmin, and which in turn cleaves the fibrin, because we know that fibrin insoluble formation of the fibrin insoluble thread, it is responsible for the blood clotting. Now this plasmin, they will cleave, they will going to cut the fibrins, and thus you can say that causing the breakdown, clear, causing the breakdown of the thrombi. Now clot dissolution or the perfusion is occurs with the higher frequency when the therapy is initiated on the early phase. So as already we have told, these are the drugs, it is most effective if the clot is less than 3 days old after the clot formation, because clot become more resistant to lyse as they age. Because if it is more than the 3 days, then it is very difficult to break down of this or the lysis of this clot. Now we know that this is the plasminogen. Clear? This is the plasminogen. Now plasminogen, through the different factors, clear, through the different factors like either TPA, kallikrein or the factor 12, it is converting into the plasmin. Clear? It is converting into the plasmin. Now what for the plasmin important? Plasmin is important because they are responsible for the breakdown of the fibrin. Fibrin is insoluble nature. Now here you can see that fibrin is insoluble in nature, and when the plasmin will act on the fibrin, they will cut the fibrin into the small fragment. Clear? Small fragment. So they will cut the fibrin into the small fragment which is soluble in nature, so it will be there into the blood and then it will be excreted from our body. Now the drug like streptokinase, uridine, these are the drugs, they are caused the directly or indirectly, they will cause the activation of the plasminogen to plasmin. Clear? Plasminogen to plasmin, and thereby they will cause the breakdown of clot. Clear? By breaking the fibrin. Of course there is some inhibitors are also there. So here mainly we are going to discuss about the fibrinolytics drugs. Now coming to the antiplatelet drugs. Clear? Antiplatelet drugs. Now in case of the antiplatelets drug, these are the drug having different types of the platelet aggregation inhibitors are there, like oral thiionopyridine like copidrel. Then you can say that like glycoprotein platelet inhibitor, protease activator, receptor 1 antagonist, miscellaneous type of the drugs is there. Along with that aspirin is there, which is a COX inhibitor. So these are the number of the drugs are there. Now platelet medication, antiplatelet medication divide into the oral or parenteral agent. So either they may be oral or that may be parenteral. Now oral agent further subdivide into the based on their mechanism of action. So the mechanism of action we are going to see. Like different type of these medications are there, like aspirin, which is a cyclooxygenase inhibitor in case of the copidrel type of the drug, or glycoprotein 1B by 3A inhibitor. So different types of the drugs are there that we are going to see into the as follows. Now aspirin. Clear? In case of the aspirin, whenever we are talking about the aspirin, you know that aspirin, it is a COX inhibitor. Clear? So arachidonic acid, in presence of arachidonic acid, they will through the COX pathway. Now COX is two types majorly, that is the COX1, which is constitutive, and COX2 is the inducible. They will produce the prostaglandin H2, and then prostaglandin H2 either the through the thromboxane synthase or the different prostaglandin synthase isomerase, it will convert into the thromboxane A, then thromboxane B, or you can say that prostaglandin G2, E2, F2 alpha and I2. So this is about the prostaglandin synthesis. Now aspirin is one of the most commonly used antiplatelet drug. Most commonly used antiplatelet drug. It works by reversibly inhibiting the COX activity. So it is inhibiting the COX activity. Now if they are inhibiting the COX activity, there is no production of the PGH2. PGH2. Now if PGH2 is inhibited, again you can say that there will be no production of the thromboxane A2 and B2. Now thromboxane work by inducing the platelet aggregation. So thromboxane A2 is responsible for the platelet aggregation, and you can say that if you can say, and PGI2 prostacyclin work by inhibiting the platelet aggregation and induce the vasodilation, which is inhibited by the COX2. Now this action is important. This action is important because smaller dose it is only inhibit the COX1. In smaller dose aspirin only inhibiting the COX1. So if they inhibiting the smaller dose we are giving, if they are inhibiting the COX1, that means thromboxane A2 production it will be inhibited. If this production inhibited, that is responsible for the platelet aggregation. So there will be no platelet aggregation. So a low dose of aspirin like 75 to 150 milligram is useful as a prophylaxis drug. Now coming to the, already we have discussed some other drugs also we are going to discuss, like you can say that already we have discussed about the aspirin. Now in case of this, whenever there is a plaque rupture, if there is a plaque breakdown of the plaques are breakdown, what will happen? It will cause the activation of GP2B oblique 3A receptor, GP2B oblique 3A receptor, which is, you can say that, present into the platelet, which is present into the platelet, and then it will lead to the platelet aggregation and thrombosis formation. It will cause the thrombosis formation. Now what are the different drugs? Like you can say that copidogrel, copidogrel type of the drug. Now this particular drug inhibit adenosine diphosphate induced platelet aggregation. So they will inhibit the platelet aggregation which is induced by the ADP. ADP induced platelet aggregation. Now dipyridamole is a antiplatelet drug. This is the antiplatelet drug and having the vasodilation property, and it is increased, you can say that act on the cyclic nucleotide phosphodiesterase, and this particular enzyme is responsible for the degradation of AMP to 5-AMP. Now this, you can say that particular cases the cyclic AMP it will be increases, so again the platelet aggregation it will be inhibited. Next is, you can say that some drugs which is agonistic of GP2B oblique 3A antagonist, antagonist, as their antagonistic effect on this particular receptor, what they will they will cause the inhibition of the platelet aggregation and thrombosis formation. So these are the some of the drugs and how they are going to act.